Hello all. Today we are going to see about some shoulder disorders such as rotator cuff injuries and all the muscles that are involved and how to test the muscles, and also about the frozen shoulder, biceps tendonitis, subacromian bursitis. So now we are going to see about the first muscle, that is the supraspinatus. The supraspinatus muscle, its primary function is it will initiate the arm abduction in the first 15 degrees and it is supplied by the suprascapular nerve. The common test which is used to test the supraspinatus muscle is known as the empty can, that is the thumbs down, or thumbs up, that is a full can, thumbs up test, where the patient is asked to abduct the arm to 90 degrees with the thumb positioned like in a thumbs down or else thumbs up, and a pressure is applied to push the arm downward. If the patient is unable to resist the pressure, then that means the supraspinatus is injured. So some of my students used to ask like the primary function of the supraspinatus is abduction in the first 15 degrees, but here the patient has been abducting at the 90 degrees and then only we are performing the test. In such a case, how can we test the supraspinatus when the patient is already abducting 90 degrees, which is a very valid question. Here you need to know that apart from 15 degrees of abduction, supraspinatus also contributes to the stability of the shoulder joint. So in this posture, when the resistance is applied, the stability of the shoulder joint is tested such that and then we find out that the supraspinatus is weakened. This is how it is helpful. The next muscle in the rotator cuff is the SITS. I stands for infraspinatus. Infraspinatus, the major action of infraspinatus is that it produces the lateral rotation of the shoulder joint. And similar to supraspinatus, this also is applied by the suprascapular nerve. So as obviously when the infraspinatus is injured, then its dysfunction results in weakness of external rotation. So sometimes it will be asked such that pitcher's injury. A pitcher will be a pitcher will be externally rotating their arm to their fullest, isn't it? So sometimes in the NBME exams, so they will be giving you right a pitcher who has been while doing the sports or during any motion, and then he had injured his muscle, and there is a positive full can test. In such a question, even though the pitcher has done an external rotation, but since there is a positive full can test, the answer should be supraspinatus injury. Then the third muscle, SIT, is the teres minor. So teres minor, as shown here, this is the muscle. So teres minor will actually similar to infraspinatus. It will also externally rotate the arm, and in addition to it, it will also assist in arm adduction. So in any exams or in even when you see a patient, when there is both a deficit of external rotation as well as arm adduction, then it is teres minor. When there is only deficit of external rotation, then it is infraspinatus. What about the subscapularis muscle? The subscapularis, its main function is medial rotation and adduction. So far we have seen that infraspinatus and teres minor will cause lateral rotation, but the final muscle, that is the SITS, subscapularis, will result in medial rotation and adduction. Okay. So maybe you can remember like the last two, SITS, that is the teres minor as well as the subscapularis, both are involved in adduction, but teres minor is involved in lateral rotation and the subscapularis is involved in the medial rotation. Subscapularis is innervated by upper and lower subscapular nerve. All the previous muscles were suprascapular nerve, but subscapularis, as the name says, it is also supplied with a subscapular nerve. Here we do something known as Gerber lift-off test, where the patient is actually asked to place his hand on the lower back, fine, with the palms facing posteriorly. Now the examiner is applying pressure to the palm and the patient should lift his palm, resisting the pressure applied by the examiner. If there is a pain or difficulty moving the hand away, then that indicates that it is a. Let's see a small overview of the rotator cuff muscles. Supraspinatus is the one which is involved in the first 15 degrees abduction. It is simple. I and T are the ones which are involved in the lateral rotation, infraspinatus and teres minor. But teres minor is also involved in adduction. Now, subscapularis, if you see, that is the one which is involved in medial rotation and adduction. There is another concept known as subacromian bursitis and rotator cuff tendonitis. Subacromian bursitis, as the name says, there is something known as under the acromion. That is, this is the acromion, isn't it? So, under the acromion, there is a bursa. Inflammation of the bursa between which is present between the acromion and the muscles. It is known as subacromian bursitis. It will present with painful arc during the abduction will result in very severe pain. But similar to rotator cuff tendonitis, where there is also inflammation of the tendon tissue. So both these conditions, both subacromial bursitis and rotator cuff tendonitis, will present with a similar cause. Like for example, they will be telling like there is repetitive overhead movements like painting over the fence or work which involves like lifting their hands above the head and all that overhead movement. And there will also be pain while palpation, and they might also complain like there is pain that's worse when lying on one's shoulder at bed in bed at night, and all these making the differentiating features very difficult. But there is a very logical difference, like the subacromial bursitis will only present with the above findings, but such as which is because it is also the bursa is getting impinged under the acromion, so therefore the findings are collectively known as impingement syndrome. But rotator cuff tendonitis will present with weakness when performing all the exam menus, like how we had seen about the Gerber lift off test and also the empty can test. There will be weakness, they will not be able to perform the test. Here there will only be having this history which is pointing towards it, and pain. There will not be any weakness of the muscles in subacromial bursitis because the muscles are not involved. But whereas in rotator cuff tendonitis, since the muscle's tendon is inflamed, it will result in weakness of the muscle along with the history, like painting over the fence or painting on the ceiling or any work like lighting work. All those history will also be there. With this, we have come to the end of our presentation. I have an announcement for you. I am planning to start classes for medical graduates as well as USMLE aspirants. If you like my presentation and if you like to be mentored by me one on one, then you can go ahead and send a message in the comments. Waiting to see you succeed. Have a good day.